We have another paper, a study of ocular fundus finding in pregnancy-induced hypertension in a rural area, in rural hospital. Pregnancy is the most physiological outcome where most physiological parameters are abnormal. Anatomical, physiological, and biochemical adaptation occur in a woman's life during pregnancy. Now, hypertension is the most common medical disorder during pregnancy. It affects 6 to 8% of all pregnancies, 16 to 25% of first pregnancy, and consequent pregnancies 12 to 15%. Vascular endothelial dysfunction like generalized vasospasm, capillary leak, and narrowing of the retinal vessels is the main pathological changes occur in PIH. And this is reversible, and the retinal vessel return rapidly after normal delivery. Ocular involvement in PIH is found in 30 to 100% of the patients. To study the fundus changes in PIH and to correlate the fundus changes with proteinuria, the main aim and objective of my study. This is observational prospective study. Here we select 100 pregnant women with pre-diagnosed PIH and exclude pregnant women with pre-existing hypertension, diabetes, retinal pathology, pre-existing any retinal pathology, and hazy media unfavored to further examination were excluded from this study. Informed written consent was taken each and every patient. Blood pressure was recorded. Routine ophthalmological examination was done. Fundus examination was performed. Fundus photography and OCT macula was done by SDOCT. 24 hours urine sample was collected from protein. Ethical committee clearance was taken, and financial disclosure was nil. In my study, majority are in 20 to 25 years, they are 54%. Mean age of the patient with significant fundus changes was 24.16 years. Mostly are primary gravida, 58%, gestational age more than 36 weeks, and 37% are mild PH in our study. Retinal changes are noted in 45% patient in which grade 1 hypertensive retinopathy was 37%. Grade 1 is the most common type of changes in overall. In primary gravida, we found the normal retina 58%, whereas multigravida 61%, and hypertensive retinopathic changes noted 39% in primary gravida, 37% in multigravida. Also, serous retinal detachment noted 3% in primary gravida and 2% in multigravida. The prevalence of retinal changes was more in severe PH, more than 76%, and noted eclampsia 89%. Association between the severity of PH and development of retinal changes was statistically significant. A significant increase in systolic blood pressure and diastolic blood pressure was seen with increase in severity of retinopathy. Association between systolic blood pressure and fundus changes, diastolic blood pressure and fundus changes, both are statistically significant. A significant increase in urine albumin was noted with severity of PIH. Association of proteinuria and severity of PIH was statistically significant. The most patients with PIH regain their lost vision rapidly after delivery. But in my study, we am searching the some women, their vision, they are not regain immediate after delivery due to the scarring of the macula and optic atrophy. The papilloedema dissolved, but the remain the optic atrophy and subretinal fluid there makes the scarring of the macula. A careful history taking is equally important, as there is high chances to recurrence of the retinal changes in PIH patient with fundus changes. Regular follow-up of the patient is very essential in all cases of PIH, and throughout the pregnancy, even after termination of pregnancy till the resolution of the retinal changes. All patients of PIH should be examined by ophthalmologist for proper management. Small sample size. Our study included only one-time examination. Also, the limited number of the eclampsia is a major limitation of my study. Thank you. This is my reference. Only the 1 year study period. 1 year study period in my hospital, Medinipur Medical College.
You're mentioning it's a one-time study.
One-time study means
How do you know follow-up?
there are no possibility to follow up. They are admitted in our hospital. After delivery, they discharge from our hospital. It is not possible to collect the data from door to door. This is a hospital-based study.
There is no conclusion regarding the status of vision after post-pregnancy. You have no
No, ma'am. It's not possible. But
Follow-up you have
first
not done,
follow-up
like
the first
that,
day after delivery first day. This data collected the after delivery first day data before discharge. We collect
You have the data first before.
first day after discharge, and we find that the maximum are regain their vision. They're complaining the admission time, but 1 or 2% they have the visual problem due to macular scar or atrophy, optic atrophy, due to papilloedema dissolve but not regain for prolonged time.
So what is your conclusion, like take home from this? As you did the study, you found how you can prevent it, or how you can improve this visual outcome?
Ma'am, regular follow-up and proper antenatal checkup, weight gain and visual problem and all systemic examination and proper follow-up and ophthalmological examination also when they are complaining the blurring vision or the eclampsia and pre-eclampsia patient, blurring vision, disorientation problem. So at first we noted the fundus examination properly where is happening the arterial narrowing.
Are you doing it routinely, like do you in the guide?
No, ma'am, we are doing routinely in my hospital. Some patient complain there that they are not seeing properly after delivery, 1 or 2%, or yearly 1 or 2 cases are found that they are blind or they are poor vision, and it is again after more than 6 to 7 months after. And we conclude that they have the optic atrophy or the scar in macula or the blood in blood vessels clotted in the CRVO. Some cases also noted in CRVO in 1 or 2%.
Those patients, did they come for follow-up? Those who did not regain the vision, did they came in follow-up in your ophthalmology?
Yes, ma'am. Yes, ma'am. In gyneopedy, tagged with ophthalmological OPD, they refer ours. Yes, ma'am. They referred us, and we follow up the cases, each and every case for dilating fundoscopy and also the OCT examination.
Okay.
Did you compare the different age groups and the findings, prevalence of findings in which age group is more? Like below 20, 20 to 30?
25 to 30 years age group is the more prevalent, and they are the 27%, and the 35 to 37%, they are 20% there. And below 20 years, they are only 2 to 3%. Majority are on only 25 to 30 age group are the more affected in PI, mild PIH.
So which age group had the maximum prevalence of retinal changes?
25 to 30 years, the more prevalent study.
Thank you.